February 10th on National Geographic.
Breaking just minutes ago, the Senate health care vote will be Thursday morning, Christmas Eve, at 8 a.m. Eastern. Now, if it passes, there's still the challenge, of course, of reaching a compromise between the House and the Senate. Can it be done? Republican Congressman Michael Burgess of Texas, who is also a former medical doctor, joins me from Houston, along with Democratic Congressman Bill Pascrell of New Jersey, and Bill is on the phone. Welcome to you both. I will begin with Representative Pascrell. As this comes to the House, everybody is wondering what will be changed. The one in the Senate took so long to be crafted out with a lot of compromises. Does it not risk falling apart, eroding, if the House makes too many changes?
Well, the conferees will be named, Liz, and then, we'll see. And there are some differences between the House bill and the Senate bill. I think most of it, though, is compatible between the two bills, except for some language. There are some sticking points, no question about it, and that's why I have a conference. I think we'll be able to work it out, and I think we'll have legislation within the next month.
Representative Burgess, do you agree with that? Do you think that we will have this legislation passed? And if so, what would you have to see before you could say yes to it?
Well, first off, just the details of what is going to happen next. I don't think we're going to a conference. I don't think they're going to a conference. And bear in mind, this is all, at this point, as much as I would like to say that we're holding things up, this is actually all a debate within the Democratic Party. That's why I don't think it's going to a conference. I think they will bring the Senate bill to the House. I think the leadership of the respective bodies will have agreed to things beforehand, and it will be passed by the House. I don't think that's a good idea. I think it should go to conference. I think rank-and-file Democrats and Republicans should have an opportunity to try to modify this bill one last time as it goes through. But realistically, this is all being driven by the White House at this point. They desperately want this bill. They want it before the end of the year. If they can't get that, they want it before the State of the Union address. And as much pressure as they're putting on people, and we've seen this in the Senate. Look at this carve-out. Look at this earmark. Look at this outright theft from the American people. And the Senate is willing to go along with it. The Senate is willing to buy it. So I got to believe they're going to put that same kind of push in the House of Representatives when it comes back to us.
All right. We'll get to your comment about outright theft in just a minute. But Representative Pascrell, does it bother you that this isn't bipartisan? I mean, wouldn't it be better for Americans in America if we could have both sides in on this discussion?
Well, I would rather have a bipartisan bill, and there's no two ways about it. And I think the president's tried early on. It's quite obvious that the leadership in the House of Representatives said there's no way that we're going to sit down and talk about this. The president wanted it. He invited him to the White House back in March. And the fact is that, John, you made a statement yesterday, and it really bugs me when you said that this is outright graft. You were in the House of Representatives when 6 years ago they passed the prescription drug bill. And you know how long into the night you and I had to stay. We voted early. Had to stay to get 3.5 hours under our belt and a final vote. You know that Nick Smith sat there and he was badgered by Republican leadership in order to get his vote. You know the deals that were made. In fact, he admitted them. Now, the fact is that you make deals and you make compromises in order to get to the final thing. You're involved so much in process, and you should be more involved in results. You had a lot of good ideas, Republicans, about health care, and many of them are in this bill, by the way.
Let me let Representative Burgess respond to that. And I would say, Representative Burgess, that you look back at past bills, such as, let's just go back recently to the original TARP when President Bush was the president. There were all kinds of compromises thrown in there, things like $6 million for makers of kids' wooden arrows, and that was a shout-out. I can't remember. I think it was Oregon. There were all kinds of things for the American Samoa and extensions of tax breaks for research and development in energy-focused states, things like that. There it is on your screen. We had adjusting the alternative minimum tax, which was pretty much for a lot of states, but then go back even further to the Farm Bill, where you had $175 million to address water issues, $382 million earmarked for watershed areas, all kinds of compromises, Representative Burgess.
Well, Well, compromise speech, and just for the record, please, I voted against that TARP bill. It was a flawed bill and is probably one of the worst things the United States Congress has ever done. This health care bill may take its place, but look at even those compromises. I mean, this is not like giving someone an overpass in their district. We've given a state an entitlement break forever, in perpetuity. What about equal protection under the law and the Constitution that's been guaranteed to us? But my constituents in Texas are going to be paying taxes and for benefits for the people in Nebraska for the rest of their lives. I mean, this is unprecedented in what is happening in this bill, which is why it brings me back to the fact that the White House wants this bill in the worst way, and they're willing to break any number of rules and arms in order to get it done.
Representative Pascrell?
Well, there's 31 million people, and according to the Senate bill, and the House bill covers 34 million that are not covered. This bill offers choice and competition, Liz, and I think that this is critical to the issue. This is not a perfect bill, and no one's calling it a perfect bill. But I think when you look at the coverage expansion, when you look at the cost containment that results, in fact, I like some of the cost containment in the Senate bill more than I do our bill. I was not successful in trying to get some of them into our bill. Maybe we'll have it now. And, of course, then the Medicare changes that are going to go on. We've settled on language concerning abortion, which is a very sensitive issue, not allowing federal dollars to be used in abortion cases, and I think this is important. I've never voted for that since I've been in the Congress for 13 years. Then, of course, to have these be escorted. I think that this is a compromise bill. There is no doubt about that. In order to have a compromise, you have to have give and take. And sometimes you give and sometimes you take.
Representative Pascrell, you began, so let's let Representative Burgess end. And what would you love to see in here that isn't right now, Representative?
Well, first off, this is a compromise bill only amongst the Democrats. The Republicans, I mean, I went to the transition team early on. It have been frozen out of this process right from the beginning.
Michael,
so don't give me that business about Republicans did not try. Bill, please, you had your choice. I did not interrupt you. The fact of the matter is, we don't do anything for 4 years about fixing problems for people with pre-existing conditions. There have been plenty of bills that have been introduced. The Congressional Budget Office says we can do that for $25 billion. Why don't we do that tomorrow? Why are we waiting 4 years? Why are we collecting 4 years worth of taxes before we deliver on anything for the American people? But the biggest thing is this bill is no longer about health care. This bill is about ideology. It's about pushing a political agenda. And the White House is going to get their wish.
Representative Burgess and Representative Pascrell, we've run out of time, but I'd love to have you both back because you guys are next. You're next up, most likely. Thank you both.
Merry Christmas, Happy New Year, everybody.
Thank you. Thank you very much, and to all of you, too. We'll see you around next time because we'll bring them both back.